So in today's video, we're gonna talk about different colors of the vaginal discharge. In my last video, I talked about what is vaginal discharge and what is normal. So if you guys haven't seen that video, please go back and check it out, and so you know what is normal. Now today we're gonna talk about abnormal vaginal discharge, okay? So let's talk about a pink vaginal discharge. I told you in the last video that a little bit of a pink color to the discharge before your menstrual cycle or at the end of the menstrual cycle is normal. So that's very normal. Some people also have a little pink discharge at the time of ovulation, which is also normal. But what is an abnormal pink discharge? So if, say, you missed your menstrual cycle, and instead of having a full menstrual cycle, you just are having a little pink discharge, and then you have been sexually active and haven't used any protection, then I would worry about something called early pregnancy bleeding, or we also call this as implantation bleeding. So if that's what the case, I would get a pregnancy test and check it out and make sure that that's not true, or that is true either way, right? Pregnancy is one of the things. If you have missed your menstrual cycle and you're having a pink discharge is what I would worry about. A little bit of a pink discharge after sex is also normal, because during sex there's friction, and especially if there's a dryness, you can get a little cuts or lacerations inside of the vagina, and you can get a little pink discharge. Very common immediately after sex or within 24 hours. But if you continue to bleed after 24 hours, or the bleeding or discharge starts after 24 hours, that is not normal. That is abnormal. Go get checked out. If you are pregnant, then even a little bit of a pink vaginal discharge could be an alarm bell for me, because we would worry about miscarriage, or we call it threatened miscarriage. So definitely time to go see your OBGYN for that. If you are postmenopausal, that means you haven't had a menstrual cycle in over 1 year, then even a little bit of a pink vaginal discharge is abnormal. You have to see your gynecologist for that, because there could be something going on in the vagina, cervix, or especially in the uterus, because one of the early signs of uterine cancer is that pink vaginal discharge, and you need to get checked out. I have a pad here. I just use some paints here, you guys, okay, to show how the pink vaginal discharge will look like it. So this is how it will look like it before or after the end of your period normally. But if it is seen, and as I told you with the conditions before, if it's abnormal, get checked out. Then the second one is the yellow vaginal discharge. I told you some yellow vaginal discharge is normal. Some people just have a yellow discharge, no big deal. But if this is something different for you, your discharge never look like yellow, and you see this color discharge, I will be alarmed. Especially if there's a itching or burning, or if there is irritation, or if you had a new sexual partner and you had unprotected sex. Because the yellow discharge can sometimes suggest sexually transmitted disease like trichomonas or chlamydia. Okay, then is the thick white chunky discharge, which looks like cottage cheese discharge. I got a panty liner here with a thick white discharge on it. It's not, so I don't have an exact cottage cheese to show you, but you know, just to give you some idea how it's gonna look like it. If you start getting a thick white chunky discharge with or without any irritation, itching, burning, redness, it can suggest yeast infection. Now yeast infection is very common. Yeast is in the vagina, and sometimes it overgrows. Sometimes people have symptoms and sometimes they don't have any symptoms. So you go to a gynecologist, they examine you and they say, oh, looks like you have a yeast infection. So why did they say that? Because they saw that thick white discharge there, and then they go ahead treat you for it. So that usually signifies yeast infection, but again, if you have it, please get checked out. And the last but not the least is the green vaginal discharge. A yellow discharge with a little tinge of a green, or a frank green discharge, okay? This is another liner with showing you a little bit of that green discharge here. Now remember, green discharge is never normal, okay? So it doesn't matter how much it is, but if you see a green tinge to your discharge, it is not normal, guys. Please go and get checked out for any sexually transmitted diseases. All right, so what's the take-home message? Take-home message is like, let's get to know what your normal discharge looks like. If you think your discharge looks abnormal, it is associated with any itching, burning, discomfort, problem going to bathroom, pelvic pain, or if you had a unprotected sex, or you are in a new relationship, please go and see your gynecologist, okay?